So here we go. So speaking about the immune system, first of all, there is a few factoids that you must master. Speaking about the immune system and the lymphoid structure. So whenever you hear something lymphoid, you need to think about the immune system. So what are the lymphoid structure? The lymphoid structure are subdivided into primary organs and secondary organs. So the primary organs include, well, basically our bone marrow and thymus. Basically, these organs are where the maturation of our immune cells occur, both our B cells and T cells. The maturation of the B cells, well, it's B cells, so bone marrow. And if we speak about the maturation of the T cells, it's T, which is like thymus. Okay, so there is quite a lot to speak about regarding the. Just a second. Yes. Okay. If we want to discuss about the immune system, so again, the bone marrow. It makes all of our immune cell production. Well, what about our other types of cell? Where are they made? If we speak about any type of blood cells, well, basically all of your blood cells are made inside of your bone marrow. And I have this question: where does T cells? Where do we make T cells inside of our body? Does anybody know where we make T cells inside of our body? It's in the bone marrow. Immunology is not super long. Actually, it's not that long. It's not a long subject, but it requires more understanding than memorizing. So, moving on, we have to speak about the you were correct regarding the T cells. They are located normally. They are made in the bone marrow, but they maturize in the thymus. So the T stands for the place of maturation, not the place of production. This is important. So next we have to speak about the secondary organs. We have the spleen, we have the lymph nodes, and we have the tonsils and Beer's patches. You're like, okay, so spleen, lymph nodes, tonsils, and Beer's patches. Well, one of these is weird. Well, why the spleen? It's an organ. These are a small structure, we get it, but the spleen is different. I want you to think about the spleen as one big lymph node, okay? Whenever you see a spleen, think about it as a really big lymph node. This way, you will be more comfortable understanding its function. So, speaking about the Beer's patches, in which organ does the Beer's patches located? Yes. So basically, the Beer's patches are located normally at the terminal ileum. At the terminal ileum. Yes, at the end of your ileum. So at the end of your ileum, the Beer's patches are located. So if we speak about the Beer's patches, they are actually super important because they take part in making some antibodies. Which antibody covers your intestine and protects it from infection? IgA, yes. See this lymphoid tissue inside of the intestine? There is this tissue here. So this tissue is basically Beer's patches. As you can see, it's under the mucosa of the terminal ileum. So this is a portion of the Beer's patches. This is a portion of the Beer's patches. This is a portion of the Beer patches. Okay, so except in the distal ileum, where else do we have lymphoid tissue in our GIT tract? we have it. So first of all, let me show you this. So this is the Bayer's patches inside of the terminal ileum. We also do have it in our basically appendix. Yeah, in the appendix it also exists, and this will be super important pretty soon. So I want you to know that if I take an appendix and I take a look at its histology, and you will be taking a look at it, and then you will be like, okay, I can see this lymphoid tissue in it. Yeah, and in the future I will tell you that one of the reasons why appendicitis occur, other than the fecal lymph, that this lymph tissue becomes super large, that it occludes. It basically occludes the lumen of the appendix. Okay, and when it occludes the lumen of the appendix, that can lead to inflammation. So yeah, so far we know the Bayer's patches are located at the terminal ileum, and the lymphoid tissue can be also located in the appendix. Okay, okay, even in the stomach you can have lymphoid tissue. Yeah, maybe you remember about a cancer called multiple lymphoma, because associated lymphoid tissue of the stomach. Yep, which is caused by H. pylori. So anyway, we'll speak about all of these later. The main thing for you now to know that there is lymphoid tissue located at the terminal ileum. So these are the peripheral organs. So they allow direct communication between the immune cells and the antigen. So let's speak about the lymph node. So this is a lymph node. If we take a look at the lymph node, we see that it has multiple afferents and one efferent. Yes, which means it's perceiving like the lymph from everywhere. What makes lymph, guys? Where is it perceiving the afferent lymphatics from? Does anybody have an idea where we get the lymph from? It's basically a byproduct. Okay, it's a byproduct in which all and each one of your cells of your body makes a little bit of it. It's basically your garbage. So everybody puts a little bit of garbage in the trash can, and then they move it within the canalization. Okay, it's your sewer house. So a secondary lymphoid organs that has many afferents, the lymph nodes of course, and has one or more efferents. It's encapsulated. So if you think about it, well, this is the capsule. Well, nice. So we will have a subcapsular region. This is why we have the capsule with trabecules as well. So if you take a look inside of it, in the first look, it looks kind of, well, I have no idea what is here. But if you take a look here to the outside, there is a capsule. Yes, there is a capsule. There is multiple follicles. Yes. And these follicles have basically a light area and a darker area surrounding it. Okay. So, and we also have this area here that looks, we have this area right here, this area right here, which looks a little bit lighter. Each one of these has a name, has a color, and has a function. So to start with, we function are non-specific filtration by macrophages, circulating B cells and T cells, and immune response activation. Don't worry too much about the names now, about macrophage, B cell, T cell. We'll speak about each of them alone as soon as needed. Let's start speaking now about the follicle. Here is one follicle, two follicles, three follicles, so many little follicles here and there. Yeah? So your question will be, well, what the hell is the follicle? What does it do? What does it have inside of it? Well, It's the site of B cell localization and proliferation. Just this is how immunology goes. Every 15 minutes, I will be giving you a new factoid, and you need to incorporate it with the previous knowledge. So, to start with, B cells, I told you they are made where? Where does B cells, where do we make B cells? Yes, they are made in the bone marrow. This is correct. Okay, and they maturize also in the bone marrow. Yes? Okay, well then they can go to lymph nodes. So in the lymph nodes, when they go inside of the lymph nodes, they can go to this primary and secondary follicles. And there is something interesting about this actually. If we speak about the primary follicle, it's the one that is ditch black. Well, not black, ditch dark, I mean. It's dark. The whole thing is dark. Well, dark versus not dark. Which one will be inactive and which one will be active? If it's dark, do you think it's active? So, here's the idea. I like to think about it as in the follicles, they are too squeezed together. They are dysfunctional, okay? In the case of a primary follicle. So, in case of this dense one, they are dysfunctional, dense dysfunctional. While in the light one, they are more functional. Why? Because, well, they are more relaxed. They can function. That's how I think about it. So, basically, the primary follicle are dense and equiescent. Basically, the B cells which are located there, in case of the dense one, are dysfunctional. They are basically just sleeping. It's a storage house. But if you want them to function, well, you need to enlarge their house to make them work. So that makes the secondary follicle much more functional. Okay. So they write secondary follicle has a pale central germinal center and are active. So when you hear the word germinal center, you must get scared a little bit, but so this germinal center looks something like this. This is the follicle, okay? So this follicle, in the middle of it, it has a germinal center. Please write a note. In the germinal center, the B cells are active. Around this activation, well, you will have residual B cells around it, yes? So you will find them where? In the mantle region. So there is a mantle region around it. Well, is there something about the around the mantle region? Yes, please write a note. Around the mantle region, we can find something called marginal region. This will be super important in the future when I will tell you about mantle lymphoma and marginal lymphoma, okay? So again, we have germinal center in the middle. Around it we have mantle. Other what? I don't get it. And the others what? So anyway, germinal center in the middle. Around it we have mantle, and around the mantle we have the marginal. So far we spoke about these layers, okay? Good. So if you get a question where what is here, and they give you an arrow at a germinal center, you will be like, okay, it's an active B cells. It's an active B cells. Yeah. So what do you have inside of your follicle? Basically, well, you will know in a moment, but basically it's a B cell. We just said that inside of the follicle, all over the place, it's B cell. A follicle consists of, a secondary follicle consists of germinal center, mantle zone, plus marginal zone, okay? So, speaking about the medulla. So the medulla, if we speak about any organ, This is its cortex, the outermost portion, and the medulla is the innermost portion. If you remember, the kidney had also a medulla. Yes, we had a cortex, we had a medulla. Can someone tell me in the kidney which area used to be hypertonic? Yep, the medulla. Good. So, yeah, the medulla consists of something called medullary cords. Okay, so these medullary cords are basically a lot of plasma cells. You are like, wait, what is a plasma cell? Well, let me tell you this, and just know it like this. If we speak about the plasma cells, it is a B cell that maturize, becomes a plasma cell. Okay, so a B cells, when it finishes its education, it becomes a plasma cells, and the plasma cells start producing antibodies. Yes, so if you want to produce an antibody, B cells cannot do that. She must convert into plasma cells, and the plasma cells make you the antibodies. Okay, so the medullary cords closely packed lymphocyte and the plasma cells, and medullary sinuses. Let's speak about this. Again, the structure of the lymph node. You have your afferent lymphatics. Okay, now we are inside of the cortex, the outer portion. So if you get a question, where is the follicles located? Are they in the cortex or in the medulla? So it will be inside of the cortex. Okay, so the follicles are located inside of the cortex. And all of your follicles are inside of the cortex. You have a primary follicles, which are dense, and dense means are they working or not? Dense means dense dysfunctional. Good. Dense dysfunctional. Good. They are not working. So and the secondary one, they have this bale area, which means it's much more relaxed. In the future, I will be telling you, well, I don't want to get you confused now, but there is something similar concept inside of the nucleus, in which if you look at a nucleus, you can tell which portion of the nucleus is active or not. So if you look at the cell and electromicroscopy, so if you take a look at the cell, you can see that this is the nucleus on electron microscopy. So there is something called euchromatin, which is the white stuff, and there is something called heterochromatin, which is the black stuff. So which one is dense? Remember, the dense one is the black stuff. That means it is dysfunctional, it's quiescent, it's latent. While if they ask you where does the transcription happen inside of the cell, it will be in the white stuff because it's more loose. Okay, so yeah, that's another concept. This is for biochem, don't worry about it now. So anyway, in the germinal center, in the middle here, it's pale whitish, which makes it basically much more active. Okay, now in the medulla of this portion, we have something called the medullary cords. So these medullary cords are actually super important. We spoke about how the plasma cells are basically made here and stored here. So they say consist of medullary cords, closely packed lymphocyte and the plasma cells, and medullary sinus. So this medullary sinus is basically the exit house. So after the plasma cells are made here, they can exit inside of the sinus and go out. You are like, why are you telling us about each of these structure? Why it's important? To be fair with you, it's not like super important clinically, but it's super important for the exam. Okay, that's why you must know it. So if we speak about medullary sinus, they communicate the efferent lymphatic. It goes away from the lymph node. Yes, and so yeah, the medullary sinus, which are these guys, They are connecting the efferent lymphatics, as you can see, with what they say. They connected with the reticular cells and macrophages. So this is actually important. So they are trying to tell you that where is the location. Yeah, yeah, actually good way to think about it. So they are trying to tell you that, remember that okay, so let me repeat this. So we have the cortex, we have the medulla, we have a lymph node. Let's imagine that this is a lymph node, and it has an outer cortex and an inner medulla. In the cortex you have follicles, okay? These follicles contain what inside of them? Somebody write? Tell me, which type of cell is inside of the follicle? B cells, yes. So we have some of these follicles are pale from the inside, and some of them are completely dark. So the ones that are completely dark are inactive, okay? Inactive. While those who are white in the middle are active, okay? Are active. So this is the first structure you must know about. The second structure you must know about is something called the medullary cord. So these medullary cord, they are just like little canals that are coming out from your follicle, okay? And as you see, they are in the medulla, not the cortex. They are in the medulla. And they contain what? Plasma cells. So at this area, remember, a plasma cell is what? It's actually a B cell, yes? So here you have a B cell, and B cell converts to plasma cells at this location, okay? Where? What do we call this? This is the medullary cord, okay? So to move on, after we have created the plasma cells in the medullary cord, well, we have to move it somewhere. So it can go out inside of the sinuses, And inside of the sinuses, it can keep moving until it exits through the efferent lymphatics, yeah? So it keeps going now. After it was made, the plasma cells, it goes to special canals, which are like the sinuses, and these canals will take it to the outside of the lymph nodes to go other places that we'll speak about later, okay? So that's everything until now. Does this make sense so far? Okay, good. So if this makes sense, that's it. That's what required from you until now. So the other stuff about the nucleus, leave it for biochem. It's not for now. So here you can see that we have the following. So they write paracortex. This is super important region. The paracortex. They write at the paracortex, which is an area. Look, so here is the cortex, which is the outer portion, which contain the follicles. But there is an area that it's not totally in the medulla, not totally in the cortex. We call it the paracortex, or near the cortex, okay? So it's located near the cortex. Paracortex is near the cortex. Super important. It contains the T cells. You must know this. Well, if there is one thing to take away from this page, is to know that the paracortex contains the T cells. So maybe it helps you. T for in paracortex, it contains T cells, okay? So it's region between the follicle and the medulla. It's paracortex, near the cortex, but it's not inside of the cortex. So it's like an area in between the cortex and the medulla. And it contains T cells, okay? So region of cortex between the follicle and the medulla contains high endothelial venules through which T and B cells enter from the blood. So As you can see, notice here, there is a lot of venules. Yes, you can see here we have the post capillary venule. The post capillary venule, maybe you remember, guys, in inflammation, I told you that the transmigration and the movement from the vessel to the outside of the vessel to the interstitium happens where? Is it in the arteriole or the vein or the venules? Where exactly? Where does the movement outside of the vessel happen? Yep, it's in the post capillary venule. Why? Because it has less layers. It's much more thin. So for the cells to move outside and to accumulate in that area, it's much more easy. Yes? Okay. So just to try to think about your immune system as an army, and he wants to always protect you. So these lymph nodes are basically multiple barracks located all over your body. Okay, barracks for soldiers basically. So your basically cortex contains your follicles, which have the B cells, your archers, who want to shoot arrows at the enemy, which are antibodies. Okay. Some of them are sleeping, these are primary follicle. Some of these archers are up and ready to attack. You also have your medullary cord, which is basically these archers step into the fight. Yes, they go to the medullary cord and they start making antibodies. You also have your paracortex, in which you have your T cells. And T cells, well, it has types. It has some smart types and it has some stupid types. We'll speak about both in a moment. But for now, I just want you to know that T cells are located at the paracortex. Well, they contain high endothelial venules through which T and B cells can enter from the blood, not well developed in patients with DiGeorge syndrome. Guys, there is a disease called DiGeorge syndrome, and this is actually why this paragraph is important. It's all because of DiGeorge. DiGeorge syndrome, these patients will have basically an anatomical disorder leading to absence of something called pharyngeal pouches. You don't have to know what is pharyngeal pouches for now. You have to know it when we do reproductive. But for now, you don't need to know what is pharyngeal pouch. So anyway, after that pathology occur, these patients lose their thymus. Yes? So they do not have a thymus. If you do not have a thymus, can someone tell me, where does our T cell maturize? Where do they become mature? At the thymus. So if you don't have a thymus in case of DiGeorge syndrome, will you have an active T cells? No, you will not. You don't have a thymus, you will not have an active T cells. If you do not have an active T cells, you are more prone to infections. I will tell you later that it's viral infection and why and how, but for now, I just want you to know that we are more prone to infection. And so this patient will have less T cells. And which area of your lymph node contains the T cells? Was it your follicle, paracortex, medullary cord, medullary sinus? Which area contained the T cells? Exactly, it's the paracortex. So it will be the area that gets atrophied in the lymph node. So this is a really common USMLE question. They don't ask it once or twice, they love it. So if they show you, if they tell you about DiGeorge syndrome, and then they tell you which area is going to be destroyed or atrophied, don't think twice. It must be this guy, the paracortex. The paracortex will get atrophied. That's it, as simple as that. Do they ask this question? Almost in every single exam. So you must master it. Okay, so you can see here we have, oh, I like this one. It's much more simple. So you have follicles, you have medulla, and you have paracortex. In the paracortex, you have the T cells. In the follicles, you have the B cells. Okay? So yeah, it's just as simple as that. Okay, here you go. Remember, in case of the follicles having white in the middle, white or pale follicle is equal to active, yes? Dense equal to this functional, yeah? Okay, so let's take a look. Paracortex enlarges in extreme cellular immune responses. So I told you one factoid. You don't have to know this now. You will know it in the future. But just for fun, I wanted you to know that B cells, it starts with a B. B cells are for bacteria, okay? Mainly. While the T cells are for viruses, mainly, okay? So the paracortex, which contains T cells or B cells, what does paracortex contain? Here we go. Yep. Come on. Yes, it contains T cells. So contains T cells. If someone has a viral infection, well, if you have a stress of an organ, you will have cellular adaptation. Yes. So you need more T cells. So you undergo the process of hyperplasia. Yes. Hyperplasia is it an increase in size or number? Exactly, it's an increase in number. Good. So EBV and other viral infection lead to paracortical hyperplasia, which lead to lymphadenopathy. Lymphadenopathy basically means an enlarged lymph nodes. So yeah, that's it for this page. This is the general stuff. A lot of stuff I told you about are general concept, nothing too deep. We just spoke about the structure of a lymph node. That's it. Nothing more complicated than that. You just need to know what is a follicle, what does it contain, what is a paracortex, and what does it contain, what is a primary and secondary follicle, what is a medullary cord. You also need to know what happens in case of DiGeorge syndrome to the paracortex, which atrophy. And you also need to know what happens to the paracortex in case of infection, which basically enlarges. You also need to know about, you also need to know that mostly we have multiple afferent and one efferent. This is actually not super important, but yeah, just a factor. Okay, and that's it for this page. Now, we have here some more anatomical stuff we'll speak about. After that, we'll speak about the spleen and the thymus. After this, we'll speak about immunology a little bit in general. So today class is only general stuff. I don't request you to know anything really deep for today. So to start with, before I speak about the lymphatic drainage, let's speak about something that makes the brain work a little bit. So speaking about the thymus, who has a bigger thymus? A 1-year-old or a 90-year-old? Who has a bigger thymus? Yep, that is correct. So during young age, you have a big thymus, but the older you become, the smaller your thymus goes. At which age your thymus goes away completely? Yep, it's actually around 20 years old. It enveloped completely. Actually, it could be earlier than that even. Okay, good. So, okay, we'll go back to that. It goes completely. So now comes the question. Well, you are telling me we have no thymus, yeah? So where will the T cell maturize? Correct? Logically question. If someone, it becomes fat. Instead of the thymus, it just becomes 5% fat. So, well, logically question, this is a newborn. Look how big is his thymus. But in an adult, well, your thymus basically get destroyed and becomes full with fat, and that's it. So you are like, okay, so where will I make my T cells? Well, here's the thing. For the sake of USMLE, you just need to know that the T cells maturize in the thymus. But for real life, I want you to, well, I don't want you to know because this is just for real life. This is not for your exam. The T cells can maturize inside of your intestine and spleen and other organs as well. So this is another topic, but for the sake of USMLE, you need to stick with the idea that the T cells only maturize inside of the thymus. But in real life, sorry, but this is a complete bullshit. The T cells can maturize in so many other places, but for the USMLE, you just need to know the thymus. So, yep, you can see big thymus, and this one is involuted basically. So, speaking about the thymus, well, on an X-ray, will you be able to see a thymus in a child? Can you see a thymus in a child? Yes, you will. You are able to see it. Can you see this structure? This thing? This is the thymus. They love showing you this picture and telling you, well, what is that? Does he have cancer? Let me show you. So you can see this structure, yeah? This is a thymus basically, yeah? They like to show you this picture and tell you, what is this? Is it a cancer? Is it a cancer? It could be a cancer. No, it's not. It's just a thymus. That's it. And they also like to show you, well, just a second. Yes, and they love to play with you with this one. Oh, yeah. They also like to play with you on this one. They show you, you remember when we spoke about the Georgie? There is also another disease called the SCID, which is severe combined immunodeficiency. In case of severe combined immunodeficiency, you will also have what? You will have absence of the T cells. If you don't have the T cells, what is going to happen to your paracortex? What happens to the paracortex in case of T cells absence? It becomes atrophied, correct? So they can show you a picture of someone with D. Georgie. This is a child, yes? So this child, when you take a look at him, he has no thymus. He does not have this thymic mass we just spoke about. No thymic mass. That means his T cells are super low. Why they would be super low? D. Georgie syndrome, okay? So someone with D. Georgie syndrome will not have a thymus, okay? No thymus, no thymus, okay? So, okay, now we take a little bit of a break. We come back, we explain all of these. These are a lot to cover. And then we speak a little bit about the spleen, the thymus, innate and adaptive immunity. Just want you to get comfortable with this concept. And if we have time, we will discuss this page as well. So see you guys in 10 minutes.